I have a question for you. Why does a beta blocker save a chronic heart failure patient but trigger an asthma attack? Okay, you will learn the answer to this question after watching this video. Today, we will be talking about beta receptors of the autonomic nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. Now, let's talk about beta-1 receptors. Are you wondering how to remember the beta-1 receptor? It's simple. You have one heart, so beta-1 means heart. When beta-1 receptors activated, the heart will beat fast and contract strongly. But how? Beta-1 receptors are GS coupled and increase intracellular cyclic AMP, thus causing cardiostimulation. So positive inotropic, chronotropic, and dromotropic effects. We mentioned stimulation for beta-1, right? Yes, because we are not done with this. There is another critical effect for beta-1 receptor, and that is renin release. As a result of beta-1 receptor stimulation, it increases renin levels and activates the renin, angiotensin, aldosterone system. We will talk about this system in another video. Let's set up the equation then. Beta-1 equals stimulation. But how? Remember that beta-1 receptors are GS coupled. So when stimulated, intracellular cyclic AMP levels rise. This increase in cyclic AMP triggers the exocytosis of renin-containing granules from juxtaglomerular cells in the kidney. Then we will continue with beta-2. Have you ever wondered how many lungs or how many legs you have? Ha! Surprise! The answer is 2. So beta-2 means 2 lungs and 2 legs. Bronchodilation will occur and blood flow to the legs will increase. Let's set up the equation then. Beta-2 equals relaxation. Now, beta-3. I want you to imagine 3 bladders and 3 fat cells. Because beta-3 receptor stimulation relaxes the detrusor muscle of the bladder, which inhibits urination. Additionally, it stimulates lipolysis in adipose tissue to break down fat. But let's ask the question, how? Beta receptors are GS coupled, and the adenylyl cyclase enzyme produced cyclic AMP. Activation of beta receptors stimulates the GS, which directly activates the enzyme adenylyl cyclase. As a result of stimulation, intracellular cyclic AMP levels increase and resulting in stimulation. Let's set up the equation then. GS equals stimulation. Now, let's remember our question. Patient A, chronic heart failure, given beta blocker. Patient B, asthma, given beta blocker. Beta blockers are life-saving in heart failure because they calm and rest the heart. In heart failure, this is what we want. However, these medications cause bronchoconstriction. They can be fatal in asthma patients. We don't want that. And that brings us to the end of today's topic. Now that you have mastered the core functions of beta receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. Why must we always block alpha receptors before beta receptors in a patient with a pheochromocytoma tumor? I will be waiting for your answers in the comments. See you later.